In the long-term care environment, it is essential and crucial for our employees to be dependable, professional, compassionate, and also have the ability to work together as a team. The participants who have gone through the HPOG program consistently, as we hire and onboard them, demonstrate understanding in all of those areas.
From my experience in the interviews I've done with HPOG graduates, is when they, number one, come, I know they qualify. And I also see an eagerness to help our families. They're genuinely in it for the right reasons, and they want a career in this.
When it comes to a hospital, you have to have the right people in the right places to make a facility like this work. So we have to combine clinical skills along with customer service skills, people skills, and we have to have that throughout a range of our positions. With the fact that the students are there in-house, and the students know exactly what we need here, we're able to focus our efforts on hiring some of the students that are prepared to do some of the jobs that we need here.
Our HPOG counselors spend quite a bit of time at the employer trainer partners sites. So what that does is it gives us the ability to learn what's important at the organization, what makes that particular agency different from another employer. We are able to then bring that information back to the participant. So when that participant sits down with a Montefiore HPOG counselor, they're not only getting what's going to make them successful as a generic home health aide, they're going to get information that's specifically tailored to what makes sense for that agency.
We have an outreach coordinator that is a road warrior and goes to great lengths to go out and connect with other providers, both to recruit potential students, but also to learn more about services that we can provide our students so that the funding does go the furthest as we can, and we're able to provide as many qualified healthcare professionals in our community as possible.
If we don't have the resource, we are partnered with agencies in the community that will provide those resources, whether it's food, whether it's any other kind of need that they may have at home that is unfulfilled.
Again, with on our advisory council, there are employers, there are training providers, there are unions, there are Department of Labor, and so on. So we're all putting our heads together to try to figure out how do we make this better, how do we make them more prepared.
I think we have found successful collaboration through shared vision and goals. We all communicate throughout our entire organizations from top down on the mission of the collaboration. The trust that's been built up through this HPOG process is truly in the outcomes and in the achievement of the participant success. And through that process, we are able to fully commit our time and our attention and our partnership to this process because we know it works.
We're very lucky in that we've built up government partnerships that have been successful at the city level with social services and with the one-stop employment system. We have our employer partnerships, and we also have good partnerships with a variety of community-based organizations throughout the city.
Well, with HPOG and Project Hope and a collaborative effort with a lot of our local partnerships, we have made a substantial difference. It's really an effort that is required from everyone to make a significant difference in having the success that we have had.
We're in the process of putting out qualified healthcare professionals every day to meet the growing divide of quality healthcare professionals with the demand that we have in our community.
The outreach that we do to get recruits into home health training takes place at community-based organizations and employment programs throughout this community. So when we're looking for folks to get into and really succeed in the healthcare industry, it's important to us to have those folks come from the community that we serve.
We don't focus on serving the easiest to serve individuals. We don't prioritize serving those that would perhaps give us the greatest financial gain, and especially in today's economy. That's something that I feel is very admirable. And I think you see that embodied throughout most of our programming and our curriculum as well, that it's there to serve the community and all types in our community, not just someone who comes prepared to succeed in college.